Nadia,
Hussain.
thank you.
So yeah, I'm an anesthesiologist and pain management physician at Jesse Brown. I've been there since 2008, and the director of the CARF accredited pain management service. So it's September, it's Pain Awareness Month, and it's like a great time to talk about what we have to offer for our veterans, for pain management, to help them improve their function and get back to the activities they love to do. And very often I see our veterans suffering through pain, and they wait way too long before seeing their doctor, their pain management doctor, because of some of the stigmas attached to asking for help if you have pain. So we want our veterans to know that they're not alone, that we're here. We've created this great program to help them. Chronic pain affects about 50 million adults in the U.S., so they're not alone. It's one of the most common reasons that adults seek medical care in America, and has been linked to decreases in functionality, mobility, reduced, quality of life. And so it's very important to seek medical care, for your pain. It can lead to depression, anxiety, and of course, this is Suicide Prevention and Awareness Month as well. So these things, they go hand in hand.
Yeah, because pain can...
And Dr. Hussain, this is Chanda. Can you tell us something about the different techniques? Because I know more people gravitate towards medication for treatment, but there are a lot of different ways where you can treat your pain. I was looking at your list, and it had acupuncture and yoga. So there's so many different ways to treat your pain. Medication is just not the only way.
Okay, so I can start with, absolutely. Yeah. And it's just grown so much, and pain management has expanded so much since I started working here. Jesse Brown has been, way ahead of the game in bringing all of these modalities for our veterans. So I can start by telling you that we provide all of our traditional medication management, interventional pain management that many veterans do know about, but some might not. But we use X-ray guidance, ultrasound guidance to do epidural steroid injections for the neck, upper back, lower back pain, radiofrequency ablations, peripheral nerve blocks, and knee, hip, and shoulder injections. We even do spinal cord stimulation. So then we also move along to, it's very important to understand that pain is not just about the particular tissue injury. We know that, there's an injury that has occurred that is causing that pain, but then there's also this emotional experience that goes along with that pain. There's your background, and so it's very important to address the mental health aspect, your emotional component of your pain. No two people are going to experience the same exact tissue injury the same way. So we do involve our pain clinic psychologist, and he provides group and individual psychotherapy, cognitive behavioral therapy, acceptance and commitment therapy, all kinds of therapies. Pain Education School. Now, this is what you were asking about, Chanda. Pain Education School is where, veterans can come in and learn. And now with COVID, we've actually put that online. He's created a nice program online where you can get all of the Pain Education School modalities, learn about those through, the online service. So we offer at Jesse Brown integrative health. It includes acupuncture, Tai Chi, movement-based pain management, yoga, Qigong, chiropractic services, and hypnosis, biofeedback. The list just goes on, and it's only growing. We also have whole health coaching, which, talks about mind, spirit, body connections. So, we live in a period where there's a lot of stress, a lot of things going on, and that can make pain even worse. And a lot of people are isolated. So it's, these are the sorts of things that you can learn and your family members can learn if you're suffering from pain or stress or anxiety. You can do some of these things by yourself at home, and these self-care techniques are very important.
That's wonderful. Michelle, are you there? Hello? Michelle Langlois, who was supposed to be with us, maybe she's not, suicide prevention lead at Jesse Brown. So we'll continue with Nadia and
Chanda.
And Chanda.
One of the questions I have, Cliff, with this, and maybe you can to speak to this. Right now we have so many problems going on, and we actually see an increase now in opioid substance abuse disorders leading to death. And there has been like at least a 40% increase over the last 2 years in people who have been dying from this. And, so what types of services do you have as far as, Narcan and naloxone and therapies, for veterans to make sure that they actually are protecting themselves at least, in those kinds of circumstances of overdose?
Yeah, so we have, great number of programs and initiatives going on, behind the scenes and, with the patients. We have, the VA has the opioid safety initiative. And so, we are participating in groups and meetings, and we review patients' charts and their histories, and make sure that, if we come across some unsafe, combinations of medications, or we do some prescription drug monitoring and we see that, something is being prescribed that might not be safe, we reach out to our veterans, make sure that they know about the OEND program, which is Opioid Education, Narcan, Naloxone Distribution. And our pharmacists, we have academic detailing, which provides, outreach for our veterans to get some of those medications to them. Our prescribers, nurses and doctors are also reaching out to those patients and providing naloxone prescriptions and education. Because you're absolutely right. We lose too many people to opioid overdoses every year. 70% of the 70,000 overdose deaths in 2018 involved in opioid. So just a very important thing that we are, just staying on top of and trying to provide the safest, most effective pain management.
And I presume that's why this is also, and you ladies are doing a great job, it's also Suicide Prevention Month, right?
Right.
Yeah, because, suicide prevention.
Yes.
There's a lot of people who would rather take the quicker way out, which is...
Yes. And then you mix this with PTSD, and many of our veterans who've come back. And this is unlike, many other time periods where you have some veterans doing 2, 3, 4, 5, 6, 7 tours, overseas. Mm-hmm. And that's many years away from home and family and sort of a disconnectedness. And when they come back, it's even more of an issue about the mental health aspects you were mentioning. So, what would you say when you're seeing people in the pain clinics, what is the proportion of people that, I know there's probably an overlap between mental health and physical, but what would you say as far, sort of the balance between people who have actually organic physical pain and those people who are coming to your clinic because of, issues they're dealing with PTSD and those sorts of things?
It goes hand in hand. It's a very high percentage of our patients do have these comorbidities. So we, that's why it's very important. Our clinic is built so that we have the pain psychologist, with us. So we make sure that all our patients are reviewed and by the pain psychologist, all their charts, as well as, having psychotherapy sessions with them. Because it goes hand in hand, pain and depression, anxiety. Both depression and anxiety make the pain worse. Pain makes the depression and anxiety worse. It's just a cycle. So, just to kind of come at it from all angles is what we try to do from the multidisciplinary approach. It's very important to note we have a very important hotline number that I'm sure you'll give out, the 1-800-273-8255.
Give us that again, please.
1-800-273-8255. And that's our, Veterans Crisis Helpline. So it's just we share that number with all our patients that walk through, and tell them to make sure they have their suicide safety plan.
Yes.
The other thing you mentioned, the opioid safety, we do have programs, very good, medication-assisted therapy programs for veterans with opioid use disorder, addiction. So, that's something Jesse Brown is doing a lot with, a lot of programming with. So, that's another thing. So patients, veterans should talk to their primary care physicians if that's something that they are, wanting to pursue: pain management, addiction therapy, suicide safety, all of that. That they're to reach out to their doctors, their nurses.
Mm-hmm.
We have our helpline as well.
And you're also seeing a lot of people with traumatic brain injury, TBI, coming back from overseas. And, is there any different treatment for that? How do you approach a patient like that who complains of pain as well? Because it's actually it's physical and mental, right? The combination.
Right.
Yeah.
Right. So that's why you hit the nail. That's why this multidisciplinary approach to all of this pain management is very important. So we, all of our patients are screened for TBI, traumatic brain injury. Our rehab services are, the physiatry service is very involved in the screening process for those veterans. And when they have pain, they come to the pain clinic, as well as, collaborate. We collaborate with physiatry, primary care, anybody that we have to. They're, psychiatrists, psychologists, in order to come up with, just very specific plans, very, particular plans for each patient.
Yeah, and it sounds like you're doing things like yoga and meditation, mindfulness and that kind of thing. And then, I guess you have an interrelationship with the people who are in the physical therapy and occupational therapy section as well, right? Because people need that physical therapy as well.
Absolutely. We absolutely need the physical therapy and occupational therapy aspect. So almost all of our patients, we refer them for some sort of therapy. In addition to we provide osteopathic manipulation within our clinic.
Oh.
But we do want to get our patients moving and mobilized. So that's where the PT comes in, the yoga, all there's mindfulness and just to get the body moving. And so that's why some of our self-care techniques come from too, just to ask the patients to get up and get moving at home, go for a walk. Mm-hmm. It is difficult these days, but,
yes.
Still it's important to get up and mobilize.
Yes.
Well, you folks are certainly doing a great job. That's for sure.
Mm-hmm.
And when you think about pain management and Suicide Prevention Month, it's just good, Doc, that these folks are doing that.
Oh, yes, absolutely. Yeah. I mean, it's really life-saving what you're doing.
Sure.
Because veterans have really no other place to turn sometimes.
Mm-hmm, mm-hmm.
And if you're, especially at this point in time, as you were mentioning, where you're self-quarantining, self-isolating,
right.
And when you're by yourself, it doesn't mean that you have to become socially disconnected, mm-hmm. or, that you are, so socially abandoned.
Right.
So to have this lifeline for people is really, really important. And I think it's important for veterans to know that it's really essential that they reach out, that you have mm-hmm. these things available to you, mm-hmm. That you can actually go to someone to take care of that pain you're having. And especially if you're having thoughts of suicidality and, right. That kind of thing, that there is someone there to help you. Mm-hmm. And it's something that is nothing to be ashamed of. It's something that many of us veterans who served overseas went through and are still going
right.
through.
Exactly.
And so it's not something that is isolated just to you. It's something that we see very commonly.
Absolutely.
Yeah.
Ladies, thank you both. You've given us some great information.
Mm-hmm.
This, of course.
Thank you. Thank you for having us.